Up to 70% of people on antidepressants still struggle with depression. And it's not just my opinion. This is from the STAR-D trial, which is the largest clinical study ever conducted on these medications. So if antidepressants doesn't work for most people, why are they still being prescribed as the first line thing for when you go to the doctor and you say to him, well, I'm feeling a bit down? My name is Dr. William Hunter. I'm a former head of psychiatry and I have over 20 years of clinical experience treating depression, anxiety, various mental disorders, including trauma and burnout. And in this video, I'm going to show you from my perspective why antidepressants fail millions of people, but why doctors are also still prescribing them anyway, and what actually works better in my opinion, and this is backed by science, and how to safely come off these medications if they're no longer working for you, or if you're experiencing a lot of dullness or a lot of side effects. So let's start with the basics though. SSRIs and SNRIs, which you must have heard of, like Prozac, Zoloft or Lexapro. See, they were designed to increase serotonin and norepinephrine in the brain. But the truth is that most people don't know is that for mild and moderate depression, they actually barely more effective than a sugar pill. Actually, in 2008, a New England Journal of Medicine study found that placebos were 82% more effective than antidepressants. And in some cases, there was no significant clinical benefit. That's pretty shocking, right? And yet, you know, the side effects are there and they're real. You know, the emotional numbness, weight gain, insomnia, sexual dysfunction, withdrawal symptoms, that's so intense you feel like you're relapsing. And where's the promised relief? You know, so instead what you're getting is like you feel like you're fading, you're just dull and you just feel numb. You know, I had so many patients that came to me with these type of stories, and you know, they used to come to me from other doctors or hospitals on 9 months or 12 months or 2 years in antidepressants, and they just felt flat, and they were gaining weight, they had no motivation, they felt nothing basically. And they can't, you know, like what's so sad, people feel like they say to you, I can't cry anymore, I can't laugh anymore, I just feel absolutely nothing. And then you have to ask yourself, is this really what we are trying to accomplish? Isn't sunlight and movement and connection and healthy diets and exercise and, you know, maybe certain supplements, isn't that a much better way to manage depressive symptoms and anxiety? And if you would like to have access to one of my free guides, you can grab it in the description below after watching the video. So, but why are these medications being prescribed and handed out like candy? Well, here's the uncomfortable truth. Big Pharma spends over $6 billion per year marketing directly to doctors and patients. So there's a very big profit motive behind this. Get people hooked, and essentially, you know, doctors become glorified drug dealers. And there's also a time pressure, and a lot of consultations last very, very short. You know, and people don't want to go into history of gut issues or diet, or, you know, and it's easy to prescribe the pill because there's such a short consultation time. We're also looking at outdated science, really. I mean, we were taught that depression equals low serotonin, therefore take SSRIs and it's a magical pill. But it's a multifactorial problem. There's inflammatory, hormonal, psychological, social, spiritual. You know, there's many factors that determines depression and healing of depression, not just SSRIs. And this is really discussed, is that many people with depression, you know, they might be grieving, they might be exhausted, you know, they might have an iron deficiency, they might be battling a thyroid problem, leaky gut syndrome, wrong diets. I think diet is a very crucial part. And we need to fix the soil, otherwise, you know, the only solution, I guess, is to have yourself numb and feel nothing. But that's not a solution, that's a slow death. So here's this in my opinion, six you know, things that can actually work and should be looked at seriously if you want to get off this medication. Duke University in 1999 found that exercise worked as well as Zoloft in treating major depression. So exercise also helps with relapses. It boosts dopamine, serotonin, BDNF, which is like your brain's growth factor. Omega-3, especially EPA. This has shown to reduce depressive symptoms, especially when inflammation is present. So 1 to 2 grams or 1,000 to 2,000 milligrams of EPA per day. Light therapy, 2022 research showed that 30 minutes of morning sunlight significantly improved depressive scores. So this resets your internal clock, and it also boosts serotonin naturally. Saffron extract, very interestingly, has been found and shown that 30 milligrams of saffron daily was almost as effective as Prozac, with obviously much fewer side effects. And saffron may improve mood by increasing dopamine and actually reducing oxidative stress. Probiotics, funnily enough, remember 90% of the serotonin is produced by your gut. So studies have shown that certain probiotics improved mood and anxiety. Now, another big one is magnesium and B6. A PLOS-1 study showed that 248 milligrams of magnesium daily improved mood over a 6 weeks period. And magnesium also calms the nervous system, and it activates GABA, and that's sort of like your brain's calming neurotransmitter. And if you're on antidepressants and they are not helping and you're feeling blunt, just please don't stop cold turkey. If we remove them too fast, it's like pulling the floor out from under the nervous system. And I think this is the problem with antidepressants, is that the doctors and the people get you hooked on it, and then once you're on it, it's so difficult to come off. So work with a knowledgeable doctor that knows what he's doing in terms of getting people off. Reduce your dose very slowly, 10% every 2 weeks to 4 weeks. Start building resilience outside of the medication. Morning sunlight, EPA, omega-3s, magnesium, daily movement, healthy diet. You can even look at the carnivore diet. It's apparently, and I've seen where it does work very well for depression and anxiety symptoms. So the withdrawal is quite severe, and read up on it, do some research, and so you can know kind of like what you're dealing with. You see, the thing is with antidepressants, they were never meant actually to be prescribed forever, but somehow it just became easy and convenient to put somebody on something and they get hooked on it, and then you keep them on that and you keep billing them, and they become like a cash cow for you. You can permanently get money from them. I mean, it's quite shocking. I used to go to doctors' practices, and at the time I was trying to buy a practice, and I walked in the door, and I still remember this, the doctor light up a cigarette, and I was still young, and all he was showing me was these statistics. Oh, look, I've got all these patients on this and this, and they have to come every month, and I give for prescriptions, and I've got all these on these sleeping pills, and these ones are on Ambien, and they come back all the time. They have to get these meds, and it really just I felt like, man, you're supposed to help people, and what you're basically running here is like you're a drug dealer. You're just a glorified drug dealer. So this is something which I think is a problem in society at the moment. Antidepressants are being overprescribed, people are getting hooked on them, people are getting addicted, and nobody is guiding them to get off. So I hope this helped. If you're struggling with it yourself, I would love to hear from you in the comments below. Tell me about your struggles, tell me what you've tried, what helped for you, what worked for you, and I would like if you can share this with somebody else and give me your insights. I hope you enjoyed the video. I do have another video up here regarding supplements that actually helps with memory decline and can fight dementia and Alzheimer's as we get older. So you might even regenerate some brain cells. So have a look at it up here, and I hope you enjoyed the video. Thanks for watching, and have a wonderful day.